So good morning all the judges and good morning to the audience here. Can I start? Okay. Is it audible now?
Yeah.
Yes. Please let me know when to start. Okay. So I'll be presenting about anterior segment OCT to diagnose occult scleral tear. It's a novel non-invasive technique. So what is common to all these three pictures what we see here? Okay. All these three cases have a suspected occult scleral tear or a suspected intraocular foreign body. So what to do next in such cases? Can we predict which cases will need an intervention and which won't? So to identify and make things easier rather than going for a surgery directly, we went ahead with an anterior segment OCT in such cases. So I'll take you around through three cases. This is case number 1. A 65-year-old male gives history of diminution of vision which is noticed 1 week prior, and he was alleged history that he did not suspect there was any trauma to him. However, if you see here, you have an area of blotchy subconscious hemorrhage, which suggests that it is already in the resolving phase. You have a mid-dilated pupil with posterior synechiae, okay, and the deep AC. You do not have the slit view here. Or the B scan was suggestive of retinal detachment. Again, our suspicion of trauma been much higher here. So if we examine this area closely, this is a small nevus here, but this area somewhere we had a doubt, a suspicion that okay, there might be a small opening. So we went ahead with the UBM and it showed that, sorry for the artifacts here, it showed a defect with suspected vitreous incarceration. So we went ahead with the anterior segment OCT for the same patient through that area, and to our surprise we found a full thickness scleral defect here with the vitreous going into the wound, as we can see here in different sections as well. So this was the first case where we tried this intervention. Coming to case number 2, we see here again a patient with post open globe injury. However, only we had a conjunctival laceration. This was a girl who was 8 years of age, and before taking up for surgery we thought let us go ahead with our intervention with the anterior segment OCT. So we see the conjunctival defect here, and we also noted a scleral defect underneath that. Okay, and there was a foreign body as well which was picked up on the B scan. Case number 3, this is a post-operative repaired corneal tear, again sent here because the patient had constant irritation, redness and congestion. To our surprise, in the AIOCMTC2 we found a foreign body which was embedded under the sclera. Okay, so there were total 6 cases where there was good correlation between the AIOCMTC2 UBM and the intraoperative findings. Intraoperatively, the surgeon could correlate with the AIOCMTC2 findings, and it helped the surgeon to locate the tear and repair it properly, or even remove the foreign body as per the location. To conclude, AIOCMTC2 is an important non-invasive diagnostic modality to diagnose especially occult scleral tears. It gives a confirmatory diagnosis of occult scleral tear which could have been easily missed, and it increases basically the positive predictive value in diagnosing such tears. Obviously, it cannot go beyond a certain level, beyond say the equator or near the spiral of Tillot to diagnose it. So surgical exploration though remains the confirmatory diagnosis, AIOCMTC2 aids in terms of identifying the tear and giving the location to the surgeon, and rate of surgical exploration can be reduced significantly with such maneuver. Thank you so much.
Very good, sir. Nice presentation. UBM or OCT?
Very good
which one is
information.
UBM or OCT, which one is better? Both are equal.
So we correlated that. Say the more crisp images you get with the AIOCMTC2, especially if it's in the anterior segment. Yes, UBM again may not be available in all the centers, whereas OCT now comes with the package of AIOCMTC2 which includes. So we do not find to be honest any difference between the two.
But if we suspect some breach in the ocular wall, UBM will require immersion aspect. So
sorry, UBM will require?
For UBM you need a fluid.
Yes.
Right? So that is a very serious issue. That is the reason UBM was not used in trauma cases.
Correct.
But entry segment OCT is non-contact system.
Non-contact
so that will be very helpful, and the presentation was very good. Fine. Thank you.
Thank you so much.
Okay, doctor.
Thank you so much. Thank you all.